Hi, and welcome to this Facebook Live conversation and our first episode of The Big Idea. I'm Joe Birckmayer. I'm with the Bloomberg Philanthropies, and I'm delighted to be here this afternoon with Frank Chaloupka. Dr. Chaloupka is a professor of economics and public health, and also the director of the Health Policy Center at the University of Illinois at Chicago. And he also leads a group of tobacco tax experts. And you all may know that reducing tobacco use is very near and dear to us here at the Bloomberg Philanthropies. Over the last 10 years, we've invested about $1 billion in trying to reduce tobacco use in low and middle income countries around the world. And this year, we're very excited to have a new team of tobacco tax experts joining us, led by Dr. Frank Chaloupka, to help us in accelerating our progress in reducing use through the use of tobacco taxes. So, Frank, it's a delight to be here with you. Very nice to have this conversation. So let's just get started by tell me a little bit about, what's the scope of the problem that we're dealing with here?
So happy to be here as well. The tobacco use is one of the largest preventable causes of deaths that we see in the world. At this point, there's about 6 million smokers. It's about 6 million people that die every year prematurely as a result of the diseases that are caused by tobacco use. But it's not just a health problem, it's also something that really imposes significant economic costs. So as an economist, that's something I'm particularly interested in. We know that tobacco use imposes significant costs on healthcare systems around the world. Some recent evidence that just came out shows that the healthcare costs are substantial. We're looking at somewhere around 5.5% of overall healthcare costs in different countries around the world. It varies a bit, more in high-income countries, less in low and middle-income countries. It varies a bit by region. But again, a substantial burden on healthcare systems. And then if we look at the overall economy, we see that the costs are even more substantial. We're looking at somewhere around $1.4 trillion a year in overall economic losses, not just the healthcare costs, but also the lost productivity that comes from smokers dying prematurely or missing time at work. And that's a huge amount. That's almost 2% of global gross domestic product, GDP.
Great, yeah. So this is exactly why we're so passionately interested about this at the Philanthropies. Now, Frank, I know a little bit about this. You're really a world expert in this. How long have you been working on this?
I've been doing this for over 30 years at this point.
Okay, so we have a true expert here. Yeah, so tell me a little bit. In this 30 years, have you seen some progress around the world or in the United States?
It's amazing how much things have changed in the 30 years that I've been doing this. When I started on this, people thought that smokers were so addicted that they wouldn't respond to tax changes, they wouldn't respond to price changes. And now everywhere I go, I hear people talking about how tax is the single most effective policy tool that we have for reducing tobacco use. So when I think about all the different options that are out there, part of what the Bloomberg Initiative supports is really trying to reduce demand for tobacco through a number of different policy interventions. And they start with protecting smokers from exposure to secondhand smoke, helping tobacco users quit, things like graphic warning labels and mass media programs to warn people about the dangers of tobacco, eliminating tobacco company marketing practices. But again, the one that's most effective is the one that we're talking about, which is significantly raising taxes on tobacco products.
Got it, yeah. So this Facebook Live session is called The Big Idea, and I think, as you said, the big idea here is about tobacco taxes. So tell us a little bit about that. What are tobacco taxes, and why are they so important?
Well, tobacco taxes are important because they raise price. And there's the most fundamental law of economics is what we call the law of the downward sloping demand curve. Essentially, if price goes up, people reduce how much they consume of something. If price is allowed to go down, people are going to consume more of it. So what we know with tobacco taxes, you raise the tax, you raise the price, and that's going to reduce how many people use tobacco and how much they consume.
Got it, okay. So I know there are a lot of different kinds of taxes on tobacco. So when we're talking about trying to reduce tobacco consumption, is there a particular kind of tax that's most important?
Well, when it comes to taxes, not all taxes are the same. We really emphasize excise taxes when it comes to reducing tobacco use. Excise taxes are the ones that are going to really distinguish the prices of tobacco products from the prices of everything else that people consume. And then when it comes to excise taxes, there's really two basic types. There's what we call a specific tax. And I think a good example of a specific tax is the tax in the Philippines, where it's basically an amount that's a fixed amount. It's an amount that's levied per pack of cigarettes or per stick of cigarettes. And in the Philippines, they've gone through a significant tax reform in recent years, and the tax there now is 30 pesos per pack. That's going to be different from what we call an ad valorem tax. An ad valorem tax is one that's levied based on price. So one example of that might be the tax that we see in Vietnam. And the tax there is levied based on wholesale price, the price that the industry is shipping the products to the retailers, and it's levied at a 65% of that price. What we have learned is that it's really the specific taxes that work the best. They're the ones that reduce the differences between prices across different brands. They're the ones that reduce the incentives for smokers to switch down from from more expensive brands to cheaper brands as tax and prices are going up.
Got it. Okay. So really, our kind of best practice recommendation is specific taxes are best in our fight against tobacco.
Specific taxes and simple taxes, taxes that are the same on all brands, that don't differentiate based on price, that don't differentiate based on things like whether the cigarette has a filter or not, or how long it is. So we see some countries where they have very complicated tax structures and apply different taxes to different products, different brands, and that's not going to have the same impact in terms of reducing tobacco use and improving health.
Got it. Okay, great. So you talked about this relationship between price and quantity and the amount of consumed. What happens when countries actually implement these taxes or try to raise these taxes?
So this is the sort of thing that you see around the world. When governments raise their taxes, when prices go up, we really see a significant impact on tobacco use. So this is a picture for Brazil, looking at what happened to adult smoking prevalence. Brazil is a country where they've really done a lot to try to reduce tobacco use, including significant increases in tax. As they've pushed up their tax, prices have gone up. And as those prices have gone up, the number of people who smoke in Brazil has gone down, mostly because adult smokers are quitting smoking in response to that tax increase.
Okay. So we definitely can see an impact on prevalence. What happens? Does the government get more money, or what are other impacts of these taxes?
Well, another impact that I think is particularly important, and one that I've spent a lot of my time working on, is really looking at what happens with kids. We know that most people start using tobacco when they're in adolescence or young adulthood, but we also know from basic economics and from experiences around the world that kids are much more sensitive to changes in price. So this is illustrated here in Chile. What we see is that, again, the government has pushed up prices through tax increases, and as they were doing that, they really significantly reduced youth smoking. So taxes are very, very effective in keeping kids from taking up tobacco use, taking up smoking, and becoming lifelong addicts. And then the follow-up to that was the question that you're asking about what happens to revenues. And this might be a little bit counterintuitive to a lot of people, but one of the things that we know is that tobacco use is what we call inelastic in the language of economics. The increases in price lead to disproportionately smaller reductions in overall consumption. Tax is only part of price. So you actually have the situation where you're increasing tax, you're increasing price, you're reducing tobacco use, but at the same time as you do that, it's actually a very effective way to generate revenues. So this is a picture from South Africa. Back in the 90s, South Africa really got serious about taking on tobacco. One of the first things they did was to raise their taxes. And as they pushed up their tax rates, they also saw increases in tax revenues, and that's continued to be maintained over the last 25 years.
That's a pretty powerful relationship there, yeah. So can you explain that to me a little bit more? So when you say it's inelastic, why is tobacco, why does it have that inelastic?
Because of the addictive nature of tobacco. So given how addictive it is, what you see, we've estimated that when you increase price by 10%, for example, about 10% of smokers try to quit. But in the end, about 1 in 5 is actually going to be able to succeed in that quit attempt. It's a very addictive behavior. People take multiple times before they can successfully quit. But we do see that quitting happen. We do see the reductions in consumption. And like I was talking about on the earlier picture from Chile, it's really effective in keeping kids from taking it up.
Okay. Are there other groups that are also that it's especially effective with?
There are. We kind of got a little bit ahead there. One of the things that we do know, though, is that when governments raise their taxes, they generate significant new revenues. And one of the things that we see is that many governments, when they get those new revenues, are going to further improve health by taking the money that they get from their tax increase and putting it back into programs that either reduce tobacco use, support smokers trying to quit, or in this case, this is from the Philippines, talking about the recent tax reforms there. Most of the new revenues that came from the tax reform actually went back into funding an expansion of their national health insurance program, creating access to health care for low-income populations in the Philippines.
Got it.
So really adding to that health benefit.
Got it. So governments can really use this. I mean, this is a source of revenue for them that they can then turn into tobacco control programs, health programs, other programs that then could further our efforts in this area.
Exactly. They could support other tobacco control measures, a lot of different things that help promote health.
Got it. Okay, super. So then can I re-ask my question, and that is, are there other groups? So you really explained that.
No.
Oh, okay. We'll move on to a different question here, and we'll circle back. I'm anxious to know the answer to my question. But so we're talking about best practices. So this is a complicated area, but there are some kind of principles around best practice that I think we all can understand. I guess I'm wondering, first of all, how high should taxes be, and what do we recommend?
So we recommend that taxes need to increase by enough to really increase price significantly to have a real impact on public health. And part of what we've done is to look around the world and see what tax levels have been. We really focus in again on what I call the excise taxes. We're not as concerned with things like sales taxes or value-added taxes. It's really excise tax that's important. And here the recommendation is that governments should raise those excise taxes so that they account for at least 70% of the retail price of tobacco products, and then continue to increase them over time to make sure that tobacco use continues to go down. But if we look around the world, what we see is that we're pretty far from that best practice. At this point, if we look globally, we see less than half of prices accounted for by excise taxes. There are some countries, higher income countries, Western Europe, that do better than other parts of the world. But again, still very far short of that 70% benchmark. Okay,
great, yeah. Well, at Bloomberg, we're really particularly interested in these low and middle income countries, and I can see that they really are significantly down below. Low income countries that are only like 32%, excise is 32% of retail price. That's low. So there's a long way to go.
Exactly. And then a country like China, where we have the most tobacco users in the world, has some of the lowest taxes, less than 30% of price.
Okay, great. Are there other best practices that we should know about here?
Sure. The other one that we want to highlight is the importance of affordability. So the idea here is that in countries, especially low and middle income countries that are rapidly developing economically, what we see is incomes are going up relatively quickly. So you may even have a situation where taxes are going up and prices are going up, but because incomes are going up so much faster, the affordability of tobacco products is going down. People can more easily buy those products. So one of the things that we emphasize is affordability. This one isn't a great example of a country that's doing a good job. So this comes from Bangladesh. Incomes have risen much more rapidly than taxes and prices. The affordability of tobacco products has come down, and as that's happened, tobacco use has gone up. So in addition to trying to set taxes high, we also want to see taxes going up enough to reduce affordability over time so that tobacco use goes down.
Got it. Okay. So basically, cigarettes need to become more expensive.
Exactly.
Yeah. Great. Okay. What's our last piece here before we start to move on?
Now we're finally getting to your question.
All right, I think, yay, we finally got to my question. I really would like to know. So you said previously that we talked about the kids.
Right, so one of the things that we know is that kids are really sensitive to price. They're just starting, they're not addicted, they have relatively limited incomes. So when the tax goes up, when the price goes up, we see the reductions in tobacco use among kids are 2 to 3 times as big as what we see among adults. And then I think the other key population that we really want to pay attention to are low-income populations. This is a group that's particularly vulnerable to tobacco company marketing, but it's also a group that really suffers from the health consequences of tobacco use. In most countries, we see tobacco use has become increasingly concentrated in the lowest income, least educated parts of the population. But what we see is that tobacco taxes are actually very effective in improving health and reducing the financial burden of tobacco use on low-income populations. So this is a picture from Turkey. Turkey has done a lot over the last decade or so in terms of reducing tobacco use, in part through tobacco tax increases. And what we've seen is that when taxes go up, we actually see very large reductions in tobacco use in the lowest income part of the population. So their share of the tax burden actually goes down. But then most of the health benefits that come from those reductions in tobacco use go to that low-income population as well. So I think tobacco taxes are a very progressive policy. Tax increases lead to these big reductions in tobacco use in the poorest parts of the population, and as a result, they get the biggest health benefits from those tax increases.
Got it. That's interesting because, we do also know that the tobacco industry really targets low-income groups, and so what you're saying is that actually tobacco taxes is a very effective way to sort of counter that and help those groups.
Very much a pro-poor policy, and especially when you start to look at things like what happened in the Philippines when the revenues go back into programs that even additionally support things like healthcare for the lowest income populations.
Got it. Okay, great. So taxes. Most people don't really like taxes very much. What do we know about what they think about tobacco taxes?
Yeah, tobacco taxes are unlike other taxes. So yes, most people don't like tobacco taxes. But it turns out that the vast majority of non-smokers, not surprisingly, are going to support tobacco tax increases. So these are some data from a survey of 18 European countries where we looked at what people's support was for tax increases in this case that raised price by 20%. And you can see across the board overwhelming support for these tax increases among non-smokers. But I think the thing that surprises a lot of people is that even smokers are going to support tax increases. So one of the things that we know is that most smokers regret ever having started to smoke. Most smokers want to quit smoking, and they realize that tax is a very effective strategy for doing that. So we even see, as much as 30 or 40% of smokers in many countries and a majority of smokers in some countries that support a tax increase, knowing that that's going to help others, particularly kids, from taking up tobacco use and becoming addicted like they are.
Interesting. So pretty strong public support for these taxes.
Compared to any other tax, this one gets more support than any that I've seen.
Oh, okay.
Yeah.
That's great. Very interesting. Great. Well, any other points before we move on? I think we're going to ask for some questions from the audience. I guess I would ask one question. You just started in the beginning by saying, there are all of these policies to reduce tobacco use. I think you might have said that taxes really are the most effective, but can you kind of talk about the packet together, why we would want to think about them all together?
Sure. I mean, one of the things that we've learned is that these policies really work together with one another. So one policy can help enhance the effects of other policies. So if we raise the tax on tobacco, for example, like I said, many smokers are going to want to try to quit smoking in response to that. So if we use some of those revenues to support efforts to help smokers quit, provide counseling, provide some of the pharmacotherapies that are available, you're going to see many more smokers successfully quit in response to that. If we do things like eliminate tobacco company promotions, particularly the ones that reduce price, that's going to help add to the effects of the tax increase because the tobacco companies aren't going to be able to come in and offset that tax increase through some kind of price promotion.
Got it. So all kinds of synergies across these. That's
Exactly.
Very helpful. Good. Well, we are on Facebook Live, which I've never done before, and so we are actually getting live questions from the audience. So I'm going to read you some and see what you think. So the first one is a question about what countries have the highest tobacco taxes?
They tend to be some of the highest income countries in the world. So Australia, the United Kingdom, Norway have some of the highest taxes. I think we're looking at prices in Australia that are over 20 Australian dollars a pack at this point. So very high taxes, very high prices, and some of the countries that have been most effective in reducing their tobacco use over the years.
So some really high prices compared to some of the countries that we work in.
Most of the countries all the countries that we work in.
Got it, yeah. So a question about there was a best practice recommendation that taxes should be at least 70%, excise taxes should be at least 70% of retail price. Is there a recommendation about should this be one big bang or should we do things incrementally? What do we know about the impact there?
So that's something that I get asked all the time, and we're actually trying to do some research on that, trying to really sort out the effects of gradual increases versus big increases. And what we see is that the big increases are really effective. The big increases are going to be much harder for the tobacco companies to offset with their price discounting and things like that. I think there's a lot of shock value to that in the sense that people notice those increases much more, has much more of an impact on their tobacco use as a result, really changes affordability dramatically. And then one of the things that we're seeing is that as prices go up, we're actually seeing smokers respond even more to those tax and price changes. So some of the most recent research that we did shows that these bigger tax increases can have a bigger impact on tobacco use.
Okay, great. Interesting. So you mentioned the industry. We actually have a question about that. How does the industry respond to taxes? Do they try to lower their prices? What do they do?
So the industry, I think, has a lot of different options, and it really depends, I think, on the environment that they're operating in, the tax system that's in place. In a lot of countries, particularly I think in what I would think of as declining markets, a lot of high-income countries, what you typically see is that the industry raises prices by even more than the tax, so you get an even bigger reduction in tobacco use. And I think that's because they realize that their market is declining. They're going to try to capture profit while they can, knowing that the market's starting to go away as it is. I think they have different strategies in places where consumers are more price sensitive, where tobacco use is still on the rise, where incomes are rising rapidly. And I think there's more of an incentive to absorb part of that, or maybe not to pass it on across all the different brands that they sell. So that they may raise the prices on the brands that are consumed by the highest income consumers, least price sensitive consumers, by more than the amount of the tax and try to capture some profit from that. But then I think they might use some of that to help subsidize their lower priced brands to try to keep some of the more price sensitive consumers in the market, to try to attract new users to the market.
So it sounds like the industry really sort of figures out how to work around these tax increases to continue to grow their market even.
The industry really understands how important price is, how important tax is, and they're going to be able to try to adapt their price strategies. And again, that's where we come back to the issue about the big tax increase. The bigger the tax increase, the simpler the tax system, the harder it's going to be for the industry to really undermine the effects of that tax increase.
Good point. So you mentioned that there are cases where the industry actually raises their prices during the tax increase, so that would seem to imply that governments could raise their taxes that much further and get that money instead of the industry getting it. Is that accurate?
The industry continues to raise its price year after year in almost every market in the world. Governments have the ability to raise price even more, capture a lot of those profits that the industry are getting through the tax revenues.
Got it. We have an interesting question. It's about tobacco manufacturers. So, most of the companies that are selling, the big companies that are selling cigarettes are from Western countries. And the question is, why do developed countries not shut down these companies instead of, putting pressure on them?
Well, I think the problem is that this is a legal product. It's been around for a long, long time. In many countries, you have millions of tobacco users, so just outlawing it isn't going to work. We've seen prohibition fail when it comes to a lot of other things. It's interesting to me, if we look at what's been happening in the U.S., for example, we don't have the greatest tobacco control policies in the world, but our policies have been strengthened over time. Taxes have gone up. And what we see is that tobacco use has come down. If we look at tobacco use rates among kids, they're lower than they've ever been since the data have been collected. But at the same time, marijuana use rates are much higher than tobacco use rates among teenagers, despite the fact that it's illegal almost everywhere. Starting to change a little bit, but that's really turned around a few years ago. So I think one of the things we've learned is that prohibition doesn't work, but what we do know is that the sort of demand reduction policies that we're talking about here can be very effective in reducing tobacco use and not leading to all the criminality and things like that would happen from a ban, an outright ban.
Got it. That's great. Well, this has been a great conversation, and I really appreciate it. I think that's all we have time for today. And I'd really like to thank you for coming and joining us for this first big idea session here. And I'd like to encourage the audience to go and look for more information on the Bloomberg Philanthropies webpage. Our work on tobacco control is posted there. It's bloomberg.org. Pretty simple. And please do like us on Facebook as well. And I believe you might actually be seeing that as you're looking at us live on Facebook. So thank you very much, and thank you, Frank, again.
Thank you. It was a lot more fun than I thought it would be.
Great.